Hello, I'm Nora, and I'm the Health Policy and Communications Associate at the Tennessee Justice Center. Recently, the Tennessee State Legislature approved a budget that includes funding to expand TennCare postpartum coverage from 60 days to 12 months. Today, we want to share why it is so important for the United States to permanently expand TennCare postpartum coverage from 60 days to 12 months. The United States is facing a maternal mortality crisis. The U.S. is the only industrialized nation that is seeing a rise in its maternal mortality rate, and at least 1/3 of maternal deaths in the U.S. happen during the postpartum period. New mothers may experience complications after giving birth, may struggle with postpartum depression, or may experience a number of other health concerns, and it is important that they are able to seek care when they need it for the health of themselves and their families. The maternal mortality crisis is disproportionately impacting women of color, and most pregnancy-related deaths are preventable. In some states, maternal mortality rates in Black women are nearly 4 times as high as maternal mortality rates in white women. For every mother who dies of a pregnancy-related cause, 70 more mothers experience severe maternal morbidity. At least 1 in 10 women experience perinatal depression, and some studies suggest that among some communities of color and low-income communities, the rates of postpartum depression are higher, and it is more difficult to access treatment. Medicaid covers almost half of all births in the U.S., and women on Medicaid are 83% more likely than women who have private health insurance to have chronic health conditions that can put them at a higher risk for poor maternal outcomes. It is required federally that women who are eligible for Medicaid because of their pregnancy must keep their coverage at least 60 days following their birth. However, most states have expanded coverage to go beyond the 60-day requirement. The 60-day postpartum requirement was put in place in 1986. In the 35 years since, we have learned a lot about the importance of postpartum care and causes of maternal deaths. These findings have led to wide agreement by medical professionals and others involved in providing postpartum care that Medicaid postpartum coverage should be 12 months for all new mothers. Extending Medicaid postpartum coverage will likely save a state money because someone will be more likely to seek care when a concern arises, rather than waiting for the concern to get worse when it may require more extensive and expensive treatment. As you can see on this map, Tennessee had previously been one of only 3 states in the country, highlighted in red, that had not expanded Medicaid and that had no family planning program to expand postpartum coverage. Between 2017 and 2019, in Tennessee, at least 173 new mothers died before their child's first birthday, many in ways that are believed by health officials to have been preventable. Most of these mothers were on TennCare during their pregnancy, and 61% died between 43 days and a year after giving birth, after their 60-day postpartum coverage would have ended. In the summer of 2020, Tennessee proposed extending TennCare postpartum coverage from 60 days to 1 year, but at the last minute, they cut the funding for this pilot program and instead put the money in the state's rainy day fund. Extending TennCare postpartum coverage to a year is estimated to benefit around 4,000 to 6,500 new mothers who only become eligible for TennCare in the pregnancy category. This picture of a crowd at the Grand Ole Opry can provide a visualization of about the number of people who would benefit from extending TennCare postpartum coverage. Extending TennCare postpartum coverage to 12 months has again been added to Tennessee's budget, and the budget was recently approved. This is an encouraging step in the right direction towards fighting the maternal health crisis. Thank you for listening.